Hello, my name is Lizeth Castillo, and my presentation is about why pediculosis is worthy of funding. Now, before I begin, I do want to explain that pediculosis is otherwise known as head lice. Now, I know we have probably encountered somebody or maybe even ourselves that have had head lice in the past or maybe even the present, and we know that the capability of this disease to spread so quickly is very concerning, so I will be speaking about that in my presentation. So what exactly causes the disease? Now, researchers are unaware of where lice originated, but they know that lice have affected primates for at least 25 million years, which eventually spread to us humans. Now, currently there are 6 to 12 million infestations that occur on a yearly basis. It is most common in children or even educators who are in public schools, and they spread extremely quickly through physical contact. And surprisingly, lice can jump from person to person, infecting the general population very rapidly. Now, some symptoms of this disease: itchiness, scratching of the head, skin irritation, a crawling sensation, swollen lymph nodes, or even sleeping problems. Complications that may come with this disease include impetigo. Now, according to a case study done by a scholar by the name of Cook, impetigo has been found to infect about 70% of children who are infested with pediculosis. Now, impetigo can lead to rheumatic heart disease or streptococcus. Impetigo is caused by the louse penetrating the victim's skull, and when they leave an open wound, this leaves room for infection to occur, so which eventually leads to impetigo, which are extremely large scabs that form on the person's head. And since this scab heals very slowly, this leaves room for, like I said, infections that come with this. Now, according to the International Journal of Pediatrics, children exposed to head lice in the earlier stages of life are more likely to experience complications as a result of contracting pediculosis. Now, some of these complications can include epidemic typhus, trench fever, or relapsing fever. Here are some complications continued. Iron deficiency anemia occurs in excessive cases of head lice when chronic amounts of blood are lost as a result of lice drinking the patient's blood. Now, this was a study done by Gus in 2011, and the patients that presented iron deficiency anemia had no prior episodes of this prior to having head lice. So they were found to have had, I believe it was less than 6 milliliters of hemoglobin within their blood, which, if you are very familiar with iron deficiency anemia, that's not very good. And when we do not have enough hemoglobin in our blood, we are not able to transport the materials around our body as we should, and this can cause things such as dizziness, lightheadedness, or even heart problems, because it makes it very difficult for our heart to pump the blood around our body if we're not presenting enough blood to begin with. Impetigo can also lead to cellulitis. Cellulitis is a potentially serious infection that affects the tissues underlying our skin and eventually may spread to your lymph nodes and bloodstream. Untreated cellulitis can become extremely life-threatening. Now, as you can see, what many would see as a non-life-threatening disease can quickly become something much more critical, and because of the rapid nature of how this disease spread, researchers should be looking for a cure for this infectious disease. Now, some current treatments that we have are over-the-counter insecticides. However, they have become resistant. Now, as we've been exposing the lice to these treatments over and over and over again, these lice are creating super lice, which have become resistant to these insecticides, and they're no longer working at the rate that they should be. So this poses threat because when these insecticides stop working, that leaves room for widespread infestations to occur because children are not getting treated, or patients, whoever we're talking about, they're not getting treated as they should, so they're just infecting more and more people around them. Now, according to Laguna in 2011, humans have given head lice an advantage by subjecting them to the same treatments again and again. Such repeated exposure builds resistance not only to the treatment, but virtually to all others that work according to the same or similar mechanism. Now, as you can see, the current treatments that we do have are not working the way that they should be. So, with all this presented, I believe that we need to put money into research to find a cure once and for all that will not become resistant to the head lice as these treatments already have. Now, current research that is being done is determining how many individuals with head lice are currently at risk for impetigo. Like I had mentioned, impetigo is caused by Streptococcus or Staphylococcus bacteria. Current research is also being done to determine how many cases of head lice are correlated with iron deficiency anemia. Now, they have found that excessive cases of head lice are linked with iron deficiency anemia due to hemoglobin levels being extremely low, like I had mentioned before, and the patients in these research studies are having to receive blood transfusions to compensate for the amount of blood loss. Just to wrap this all up, why is pediculosis need of funding? So, an official treatment needs to be established to avoid the potential for a worldwide outbreak that is unable to be fixed. Now, we've mentioned before, the fast nature of spread and to avoid the potential that lice have become resistant to the medications. Treatment needs to be given in order to avoid complications that may become as a result of pediculosis. Like I had mentioned, all those complications are able to happen to anyone. So, if we continue to go down the route with these kind of treatments that aren't working as they should be, we're just leaving gaps and room for worldwide outbreaks that can potentially become something a lot worse than what it should be. So that is why I believe that pediculosis is in need of funding.